Hello, everyone. Hello, and welcome back to our series, the Drawdown Georgia Climate Interview Series. My name is Eriqah Vincent once again, and I'm really glad to be speaking today with Dr. Preeti Jaggi, who is on the steering committee and with the Georgia Clinicians for Climate Action. Thank you so much, Dr. Jaggi, for being with us today. I really appreciate it. I'm really excited to talk to you. So please introduce yourself for our audience and tell us about the work that you do.
Sure. I'm Dr. Preeti Jaggi, and I'm a pediatric infectious disease doctor. So I did pediatrics residency, and then I did an infectious disease fellowship. And I have been increasingly concerned about how climate change affects kids' health. So I have gotten into a lot of advocacy work to try to decrease greenhouse gas emissions, to improve the lives of children who are going to be most impacted by climate change because they'll be living more years in a changed climate. I work with the Georgia Clinicians for Climate Action. And for those of you who don't know, there are many state groups of clinicians that work to decrease greenhouse gas emissions. There's the Medical Consortium for Climate and Health, and that's a national organization. And Georgia is one of the chapters of that national organization.
Oh, okay. That's really good to know. Thank you so much. And thank you for the fantastic work that you are doing. That's super important. So take us back to when you yourself began to emphasize climate issues in your career and in medicine, not something that people typically think of immediately when it comes to doctors.
I was always very drawn to climate and health. Actually, ever since I was in high school, I remember watching an Earth Day special on TV in the 1990s when I was in high school, and I was really concerned about how does, climate affect health, and kind of in the back of my mind, though I didn't really know the verbiage around that at that point because I had not been to medical school. I remember making my parents, recycle and things like that, and sort of getting into taking care of our climate and our environment at that time. And then when I was in medical school, residency, and then I had children, I was pretty busy. I worked a little bit. I remember taking my kids to a community garden and we would volunteer there, but I didn't have as much time. And as my kids got older, they're now in college, I was able to kind of get into this space. I did the Climate Reality Project training with Al Gore's group in 2017. And then I started doing a lot of work in the community in the city of Decatur, working with some colleagues to try and have clean energy goals in my city. And then I also took some climate and health classes that some of my colleagues at Emory do, and really got to learn about air pollution a little bit more, learn about how climate affects health. In healthcare, we also contribute a lot to the greenhouse gas emissions in the United States. We account for about 8.5% of the greenhouse gas emissions. And so I started getting involved in that area. So really some of it's community work and some of it is in the hospital itself. More recently, I've been working with Mothers and Others for Clean Air, which is a wonderful organization that works on air pollution. And we have been working on electrifying school buses and how do we do that? So that's been our more recent project. So, I think for me, it's been a little bit incremental. I started a little bit here and then I kind of moved along with that as I got older and I had a little bit more time. And it's been really wonderful for me. I find a lot of satisfaction in doing this work because I really think it's doing something that is really needed and that not enough people are doing.
Absolutely. And I thank you so much for that information. I didn't know that the medical field was contributing in what way to the greenhouse gas emissions. As a mother who has very small children, I'm a little bit on a different angle of motherhood than you. I have a 4-month-old and then a 4-year-old. My 4-year-old has intermittent asthma. So when she gets sick, she gets really sick. I'm always thinking about air quality. And we were just doing her in hair last week. I had a cold. And so I'm always thinking about air quality and how are we contributing to that, and thinking about the ways in which the way that where we live not too far from interstate. And so how is that contributing to other issues? Hearing about doctors prioritizing clean air is something that is new for me to hear about. And so I'm really admiring you for kind of honing in on that as a way to get into the climate field. Because we also talk a lot on this show about the different avenues that people have taken to get into the work. And so, as a doctor, to see that as part of the work, I think is really inspiring.
And I think many doctors are getting involved in this now, especially as we see how climate affects health, how people get displaced from their homes. I think around the country, you'll see more and more groups that are gathering steam together to do work. So that's been nice. I think maybe 5-10 years ago, that wasn't the case, but I think that's really maturing now in many different states around the country.
Right. What are some of the most significant ways that climate change is impacting public health that you see in Georgia?
So in Georgia, one thing that we definitely see is heat. Our summers we have more hot days, and that can lead to heat stroke, for instance. So that's definitely one thing that we see. We also see more extreme storms. People have gone back to Hurricane Helene and looked at the contribution of climate change to Hurricane Helene and really determined that it has been made stronger and more powerful because of climate change. And the ways that we see that after those storms, we see kind of indirect effects of climate change or extreme weather. One is that we know that our waterways can get overwhelmed when we have very, very extreme precipitation, and that leads to more diarrheal illness. We know that vectors breed like mosquitoes would breed in standing water. So there's another example. And then we know that people are displaced from their homes. We know that after Hurricane Helene, 1-month-old twin babies died in Washington County, Georgia, from that extreme weather. A tree toppled onto their mobile home. And then we do have downstream effects. I don't know that people really recognize those, but the Baxter plant that provides quite a bit of saline for the United States in North Carolina was decimated. And we had to really ration our saline for a period of time because the saline was primarily made in that Baxter plant. Prior to this, in 2017, there was Hurricane Maria that was in Puerto Rico, and we also had saline shortages and drug shortages after Hurricane Maria. So I think that there are downstream effects that people don't realize. And then also people cannot get to their visits that they need to get to. So we sort of think about climate change as being direct effects and indirect effects.
Right.
And some of those indirect effects are the things that I see: infectious diseases, waterborne illnesses from bacteria, and things like that. And then there's also displacement from your home as well. So there's lots of ways that it affects us. Sometimes it so profoundly affects us in so many different ways that it's hard to label that it affects us.
Right. I like how you put that with all of the direct and indirect ways along the chain, sometimes the supply chain of like ways in which we are dealing with climate change in the state and really obviously around the world. So we know that some Georgia communities are impacted more than others, obviously, for some obvious reasons and maybe some non-obvious reasons. So how do public health and climate intersect with the issue of equity specifically?
Oh, I think they intersect profoundly. We know, for instance, with air pollution, many areas that were previously redlined, they don't have as many green infrastructure or trees. And so air pollution can be worse in those areas. Urban heat islands can be worse in those areas. And then I think when we think about equity, we know that the people that have the least to deal with the disruptions from climate change, they're going to be more profoundly affected. They won't be able to deal with the effects as easily. You think about a storm coming and people fleeing, you have to have gas money for that. So there's a profound intersection between extreme weather and inequity, but also areas that have been previously disadvantaged have less green infrastructure in their areas, and that worsens urban heat islands and air pollution.
Absolutely.
Living near a major roadway is also a risk factor for more severe asthma. So, that where you live is determined often between like what has been determined from prior generations about where you can live. So I think they really do profoundly intersect.
I'm glad to hear you say that. As somebody, I live on the east side of Metro Atlanta as well, a little further east than you if you're in the Cape Town.
Yep.
In thinking about, again, taking it back to my daughter, when the bio plant exploded in Conyers, for example, they didn't take the kids outside at her daycare because, it got all the children, and then they got multiple children in there with asthma. So they got all kinds of issues in there. And, living near interstate, to your point. But also, I think it's really important what you said about the ways in which we're thinking about inequity from a redlining perspective, racial inequities. And then when racial inequities meets climate injustice, meets income inequities, when people can't talking about like a Hurricane Katrina or other hurricanes, where are we going to evacuate? There is no evacuation. There is no way to be able to do that. And so I think that's really profound what you just mentioned about the ways in which we're thinking about climate change. And there's another chain of indirect ways. It's not just a tree fell on our house, we don't have gas, the children have asthma, multiple ways.
Right. And your insurance, maybe you can or cannot afford as robust of home insurance. So there are a lot, like, how do you deal with these problems is going to be profoundly affected by your means, unfortunately.
Right.
So it is something, and also if you think about extreme heat, also makes your power bill go up. So that's another area that some people can afford and some people cannot. So I just think they really do profoundly intersect with each other, and trying to help, especially those with less means, is a really good idea.
Right, of course, sure. So Georgia Clinicians and Climate Health is wrapping up a project funded by Drawdown, Georgia Climate Solutions and Equity Grant. And I'm on the advisory committee for that grant, and remember seeing the proposal and remember saying very specifically, like, this is super important work, y'all. This is the innovative work that people are not necessarily thinking about, but like thinking about doctors who are doing like nonprofit funded work to work on climate is really, really important. So I'm so glad that you all were awarded it and that you were able to do that really important project. I'd love for you to talk about that work and the project that you all were funded for Drawdown, because I think it's super important, innovative, and significant for the way that we're looking at climate work, not just from regular nonprofits, but also from scientists like doctors.
Yes, it was great. We really appreciate the funding. And really what kind of we thought about was, how do we really elevate the idea that climate is a health issue? This idea of One Health is an idea that was coined some time ago, which is the idea that the health of humans is integrally tied to the health of animals and our shared ecosystem. So the planet, animals, and humans, we're all interconnected. We think about that with antibiotic resistance. I'm an infectious disease doctor, that the antibiotics we use in livestock can affect resistance, which affects humans. So we really have been thinking about that. And so for this project, we were thinking about air pollution and how air pollution has a profound effect on children. And we partner with an organization called Mothers and Others for Clean Air and Georgia State Medical Association, which is an association of Black physicians who have a special interest in equity. And so we all got together and we thought, well, there is funding for schools to get money from the Inflation Reduction Act for electric school buses. But there's a workload involved in it. You have to apply for a grant. You have to train your drivers. You have to get your hookup for your bus to be plugged in. You have to learn how to use it. And it's a newer process. And so that can be uncomfortable for people. So we thought what we could do is we partnered with healthcare providers who were speaking with the school boards themselves about the importance of electrification. Why is it so important? Because we know it affects children's cognition. The air that they're breathing that's coming up from the bottom of the bus will affect their cognition and their respiratory function. And you also think about the bus driver who is having a more sedentary job sitting in that bus as well, because we know that air pollution is also associated with heart attacks and stroke. We would have a healthcare provider go first, make contact with the school in some fashion, either at the school board meeting or speaking to a transportation director, and really telling them the why. Why is this important? Why is this a good idea? We also are decreasing air pollution for the rest of the community as well. So there's community benefits as well. And then after that, our colleagues at Mothers and Others for Clean Air would come in, and then they would talk a little bit more about the feasibility and how do you do this? How do you get the grant? How do you help them write the grant? How do you help them figure out about the connection? I know one of my colleagues, Tanya Coventry-Schrader, was going talk to Georgia Power. How do you get these hookups? Because you need a special hookup for those buses to be charged. We did the why with the healthcare provider, and then we followed it with some logistical help to help schools get the electric school buses. And then we do a lot of community advocacy too. We talk to people at different community fairs and things like that. And it's been really fun. Actually, a few weeks ago, we went to an event and we had an electric school bus, and the electric school bus driver was there. And she was just telling us about how quiet it was, how she can hear the kids talk, and how she really enjoyed driving the electric school bus. And then we also have had some troubleshooting. There's been some issues also with these newer buses, maintenance and things like that, that we've also helped with as well. So it's really been important for me. It made me think that, you really need a village to help with these problems. You cannot have somebody with only one area of expertise. Right. It would be really useless just to have the doctor talk, because we couldn't follow with the logistical piece. So that's not as useful as that we talk about the why, and then somebody else comes and helps them with facilitating getting these buses. So it takes a lot of people working together. And I think that's sort of a theme for me in any kind of sustainability work, is you need to be cross-disciplinary and really work together in order to make progress. You cannot think in silos. If you think in silos, you'll just find obstacles and you'll stop. So working together has been really wonderful. And I've met a lot of great physicians from the Georgia State Medical Association from around the state, not just in Metro Atlanta. That's been just so wonderful to talk with them. And then the other thing about this project is that we also are engaging in other things that are going on the federal level, like the EPA pollution standards. And then we can draw upon colleagues that have helped us with another project to say, oh, okay, can you do this other thing now? Yeah. So it's creating a little bit of a network of clinicians that can do work around advocacy.
As somebody who's seen the wonder and the power of collaboratives, I couldn't agree with you more about the ways in which, who has the expertise and how are we using the expertise at the different levels. So thank you for kind of mapping that out at all the levels, and also the troubleshooting of it. And I guess, we wouldn't even imagine, well, we can't just plug the bus up into the side of the school. It's a very specific plug, where we're going to plug them up. What's the logistics around that? I mean, that's a whole other level of, and then you have the funding aspects and so many other aspects. Can I ask you, what's the reach that you all have had? Is it Decatur? Is it the county? Is it the metro? And kind of how many schools off the top of your head that you might know that you all have been able to reach, or how many clinicians have been able to speak to their school boards or whatever your metrics that you're using for success?
This is a statewide effort. So it's not just I've spoken more in DeKalb County because that's where I live. We are kind of, our initial idea was to go to areas that had either poor air quality or children were spending more time in the buses, because we really wanted to go with a Justice 40 kind of initiative initially. And, I will have to say, one of the things that I learned is that these things are so complicated. Some areas of the state don't have any air quality monitoring. We don't have the data. Some areas do have ratings from the American Lung Association and some do not. We also looked at some rural areas, and the rural areas, some of them, they drive much longer distance. So using the electric bus is a little bit harder in that area versus another area. And some of them keep the bus at the bus driver's home. So where would you charge it? Usually you're thinking about going to a central area. And then we learned also that some systems tend to follow another larger school system as far as their operation. Ideally, we would say we want to go to this area because of X, Y, and Z, very, very clear-cut reasons. And we had to really think through also what's feasible.
Yeah.
And that gave me a lesson in just going from what you want to do, but then also modifying it with what's possible, because you cannot always go on a very sort of cut and dry, like this is what we should be doing first, and that's going to work, because it doesn't always work. So listening to different counties has been really great. APS has been wonderful. Atlanta Public Schools has been wonderful, and kind of showing their buses in other areas of the state as well. And we have basically 3 tiers. Some counties have already applied for the school buses. They had already done it on their own. Some of them we helped apply for the buses, and some of them we've had a little bit of shakiness with if there's funding this year. So through the end of the year, some of the funding we do believe it is open. So we're kind of now going back to that. And then the other thing we did too, and I will credit Mothers and Others for Clean Air, they actually got filters for some of the air buses as well. So some of the buses that couldn't go to electric because it is more expensive and they didn't have the funding,
Right.
We also actually had acquired some filters to actually decrease the air pollution from the exhaust pipe. So that we can also do, and that's also beneficial to the health of children and the health of bus drivers. So we're just kind of trying to do as much as we can.
Right.
I think one of the partners that we also found were the school nurses. When we went to DeKalb one time, it was School Nurses Week, and some school nurses were there, and that was just a wonderful thing to meet them because they take care of kids with asthma, and then they were really, really happy to talk to us about that.
Absolutely.
So
Absolutely.
we're going to continue working as long as we can to, speak with providers. One of our providers, a pediatrician, just spoke in Gwinnett, and then they kind of responded and are working on getting buses in Gwinnett County. So that was just a direct connection of one pediatrician.
Wow.
And that was really, really cool.
And I feel like the theme of our conversation today is all the ways in which it's not just my work is doing the thing, but it's like all the ways that it hits on all levels, because you're like, well, we were just going to go down there and talk to folks about getting buses. And I'm like, well, actually the bus is parked at the bus driver's house. It's like, wait a minute. So where are we going to plug up the bus? Well, it's actually, or water on the road, and that's an infrastructure issue, or this or that. So it's like more ways in which collaboratives and conversations and people with multiple expertise is important to the larger work. I feel like that's becoming the theme of our conversation.
Yeah. And creativity. I think a lot of creativity. You have to have creative thinking from multiple different people. So I do think that's been a really good lesson. And you have to listen. Something you may think is very, very easy, and it may or may not be easy. Then you have to listen to why is it not easy, and then see if you can help, get around that problem.
Absolutely. Like you said with the air filters, like we can't do this, but we can do something. Which I think is the most important thing. You already talked about it a little bit, but I don't know if there's anything more you wanted to talk about in the sense of why increasing the adoption of electric school buses is so important.
So electrification is so important for multiple reasons. One, even if you were using a lot of fossil fuels to power your electricity, the electric vehicle is more efficient than a gas vehicle, a diesel vehicle. So that's one thing. The second thing is that the electric vehicle does not emit the air pollutants like particulate matter pollution. You get a little bit of that from the tires, but you don't get that from the exhaust pipe. So that's another reason that that's important. So it is both a climate change solution in the sense that it'll decrease carbon pollution because it's more efficient, and it is an air pollution solution in that you will decrease emissions that decrease air quality. And we know that that directly relates to asthma. We know that that directly relates to stroke and cancers. We know that directly relates to cognition. And we know that even for kids that don't have asthma, their lung function is improved every time that our air quality has improved. So air pollution is such an important contribution to sickness and even just premature birth. So really across the age spectrum, air pollution is so important. And also electrification is better as a climate change solution. It'll decrease the greenhouse gas emissions because it is a more efficient vehicle. And you cannot get to be off of those fossil fuels unless you have electrification, because every time you're using the fossil fuel to power the vehicle, you have a chance to make that all clean energy if it's electrified. But if it's not electrified, you don't have any of that chance. So those are many reasons why electric school buses are really important.
And then there's the equity issue. Once again, we know that Black children specifically are twice as likely to go to the ER per year than white children when it comes to asthma attacks and other asthma-related issues. So there's more of the equity thing and race conversation, as well as all the air quality and climate change issues that you just mentioned as well. Why something that's become so important.
And premature birth. So that's another thing, that African American children are more likely to have premature birth. So those are many, many reasons to electrify.
Absolutely. We've also had someone else talking about electric transportation on the show this year. So I'm really glad we're diving into this. It's not my wheelhouse directly, but I'm learning a lot about electrification of vehicles specifically and why that's so important to multiple communities, all of our communities, and certainly to the Black community. So how can the Georgia climate community support this really, really important work that your organization is doing?
We are definitely always looking for champions to help us spread the work that we're doing. We are training any healthcare worker, so actually therapists, social workers, anybody that works with patients as a Healthy Air is Healthcare champion. So what we do is a short training for them, usually on a Sunday afternoon, and then we go through with them, a little bit of information, especially about air pollution, because many of us have not gotten training in that. And then we ask them to do some advocacy activities, anybody that might be interested to join us. And then our other organization is Mothers and Others for Clean Air. So that's a great organization to join if you're a parent or somebody that's concerned about this. Mothers and Others has some really wonderful information where we can have the public join. And then we do oftentimes call on people to help us with some advocacy writing to a government official or things like that. We did also work on encouraging people to vote in the Georgia Public Service Commission election this year. We made some materials about that, just educating people about why is that so important. So we definitely would love to have people join us. I can give you our information here in the chat. And then, supporting our work, we are going to plan on continuing our work as long as possible. Mothers and Others for Clean Air does some other work as well around indoor air quality that people can get involved in. So just reach out to either Georgia Clinicians for Climate Action or Mothers and Others for Clean Air, and we'll be happy to have you on board as a healthcare champion.
Awesome. I love that. Thank you again, Dr. Jaggi. This is really important work. I really feel very strongly about the entrance of medical professionals in this conversation around climate. I think it's a big step, and it's not necessarily something that people automatically think, but I'm glad to hear you say that more and more doctors and especially pediatricians are finding that is an important conversation for them to be a part of.
Yeah.
This is my favorite question. It's our last question. I can't wait to hear your response. What is giving you hope around climate in Georgia?
What gives me hope around climate in Georgia is meeting people that are doing the work. I gain a lot of energy from hearing what people are doing. I just think that there are so many people that are on little local levels that are doing work in this area. And sometimes people look at the federal level and say, oh, they're not doing this, or they're not doing this, or this is going badly. But that doesn't change what's going on the ground. And what people are doing on the ground is really, really working. And it's in small little systems. And I think when I see those things happening, that gives me hope. We don't need to ask anybody at the federal level about what we're doing. We're just working in our local levels, whether that be, I gave a talk this morning to our faculty about how we can decrease our own emissions by avoiding unnecessary tests in patients. That decreases waste and things like that. Talking to our school boards, talking to people who are doing the work in Georgia, that gives me a lot of hope. There's so many wonderful people that I've met doing this work, and that's what gives me hope.
Amazing. Thank you for what you said about, we're not worried about what the federal government is doing. The local work is happening. It's continue to happen. And my best friend always says all politics are local. And we know that this local work is so, so, so important for all the work to continue. So thank you so much for saying that. Thank you for the work that you and the Georgia Clinicians for Climate Action are doing. Thank you for the work that you all have done on this electric school buses project. I think it's so important. Thank you once again for joining me today. I really appreciate it. It's nice to speak with you, Dr. Jaggi. Thank you all so much for joining us for another iteration of our interview series here. I hope you all will come back. And I hope also that you will make sure that you view all of our interviews that we have. They're all on our YouTube channel. So please go back and view all of our amazing interviews that we've had over the course of the last 2 years. It's been really fantastic. Thank you again, Dr. Jaggi. And thank you all so much. And we'll see you all next time.